Good Saturday morning to everybody, and welcome to HyperFit Radio Show, along with Dr. Charles Guglin. I am Gary Byron. Good to see you, Doc.
Hi, how's it going, man?
Good. How are you, my friend?
Good. The weather's here, man. Spring is here.
Hey, look, I mean, it's here for now. It's still March. Granted, it's the end of March. And by the way, and it's funny that you mentioned that because I've had a conversation now 2 or 3 times just in the last few days where April, for the last 5 to 10 years, I don't know, has been colder than I ever remember April when I was a kid. Yeah. And October is warmer nowadays than I ever remember as a kid. Mm-hmm. You know, so it's almost like they've done a reversal. But and of course, April's always notorious for bringing showers. But listen, we'll take the nice weather. I don't want to be Debbie Downer here. We'll take the nice weather as long as we can get it. All I'm saying is,
March always bites us in the butt.
It always does.
Yeah.
That's what I'm telling people. You got to be careful. You know, it's not quite over yet. You know, when I see, I usually use tax day as like that line of demarcation. Like once we get past April 15th, I'm like, all right, I think we're pretty much in the clear.
Yeah. Plus, if you got your taxes done, you feel a little bit of relief anyway.
Especially if you get money back. Right? How was your week, by the way?
It's good. Yeah. It's good. We're busy. Busy is good.
I'm
busy is good.
Glad, very glad to hear that. You know what I want to talk about this morning, and I know this would be right up your alley, because you've hinted about it before.
Sure.
Let's talk a little bit about both Botox and fillers, and we'll try to differentiate. Are they one and the same? Something tells me that we can differentiate them. Mm-hmm. So let's start with some very basics. Well, let's start with what is Botox? We've heard it.
Yeah.
We know people get for wrinkles, right? I'm sorry, I don't want to step on your.
No, it's fine. Yeah.
If you get like crow's feet, if you laugh a lot, or wrinkles on the forehead, it's like, let me just do.
Yeah, you got your share.
Oh, sure. Sure.
Yeah. Botox.
Not telling me anything I don't know. You be quiet over there, Ryan. Our producers, he liked that comment.
Botox, first of all, is a trade name. When you reach for a tissue, you reach for Kleenex, right? Botox is like that. Botox is a neuromodulator, as is probably the other big name in that business is Galderma makes one that's basically just like Botox called Dysport, Dysport. So now I've covered both brands, so I don't feel bad about using that word. But neuromodulators basically. Everybody thinks that what these neuromodulators do is paralyze your muscles, okay? Because the reason we have wrinkles on our face is because the skin there is attached to muscles. They don't really paralyze the muscles. What they do is they eliminate for a short period of time, matter of weeks, the communication between the nerves that activate those muscles and the muscles themselves. So the muscles just relax. And when those muscles relax, we can't move our forehead, we can't move our eyes, we can't move our eyebrows the way we typically do, and so the wrinkles go away. And that makes us look younger, maybe more alert, maybe more well-rested, so on and so forth.
But it doesn't last forever, does it?
No. It's depends on, it's completely different from person to person. So it can, and plus the dose that you use. So it can last anywhere from 6 weeks to 6 to 10 weeks, more in the 6 to 8 week range. Mm-hmm. Yeah.
And so, but it's not to do in lieu of a facelift, right? It's not like, well, I'm either going to get Botox or get a facelift, because a facelift sounds like it could last for a few years, where Botox, you're saying 6 to 8 weeks.
Yeah. It's very definitely, it's nowadays, and we'll talk about facial volumization later, which is the filler part of it. But nowadays, with these two methods that are out there, you can really avoid surgical facelift for a really long time.
Oh, well, then how does it work?
You mean the neuromodulators, the Botox?
Yeah, how does the Botox work?
It works exactly that. I mean, it's the FDA has okayed Botox for the longest time for the upper face. What's called the frontal muscle, which is the frontalis muscle, which is the muscle that moves your forehead and creates those lines up there. What's called the glabellar complex that does this, gives you the what
they know
between the 11s, what they call the 11s.
Yeah, between the eyebrows. Yeah,
right. And then the smile lines, the lines around your eyes, and so you can pretty much eliminate those by relaxing those muscles with the neuromodulators.
So this is really strictly. It's limited to the face, then? You wouldn't get them on your neck or your hands or your arms or...
No, I mean, there are some people who have the platysma muscle, which is the muscle in the neck that does this. Some people have rather tight muscles there. You can use Botox there. And, of course, there are other therapeutic uses for neuromodulators, migraine headaches. GI docs use it for a problem called esophageal spasm, which is a very painful thing. And if you use the neuromodulators to relax the muscles in the esophagus, that can go away. There's other things that are that Botox can be used for. Anal fissure is one of them, but which always used to be a surgical problem. And so to a certain degree, it's very helpful because Botox can be used for that, and you can avoid surgery. So it's used for certain therapeutic problems as well.
I guess I can see why people would want it.
Yeah.
You know, but it's not just. Is it strictly for vanity's sake, or
Well,
does it?
well,
Are there
look,
other?
dude, every single person on the planet looks at the mirror and sees something they don't like.
I'm
So go ahead
not
and call that
disagreeing
vanity.
with
Yeah.
that. I'm not disagreeing with that. But that's what it's predominantly for, right?
Sure,
There's no
absolutely.
other medical purpose for having.
No. It's aesthetic. It's aesthetic.
And not that there's anything wrong with that, right?
Yeah, no, absolutely.
It helps pay the bills. you know.
Absolutely, especially during the Zoom era. We're all looking at our faces all day long, so it's become something more than it was a year ago.
Makes me wonder though, if it's painful or not. It sounds like it could be, but I don't. I've never had it, so
Not well. It's done with needles, okay. But the needles that we use are 30. I use a 32 gauge needle when I do Botox, which is super small. It's about a little bit thicker than a hair. I mean, it's like you'd have to look hard to see that needle. So it's thin. It's multiple small injections, and they're mostly subcuticular injections, so they're injections in the skin, and it goes bam, 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 bam. It's very quick. You can do a whole Botox treatment in about 5-10 minutes. So it really goes fairly quickly. Yeah.
that 5-10 minutes.
Well, you talk to the patient, you get things marked and all these other things. The preamble to the actual treatment is a half an hour. I mean, it takes a while to talk to a person, evaluate them. There's lots of pictures involved. You want them to look in a mirror, and the first question you always ask is, what's bothering you? And so once you assess what is bothering them and you deal with unrealistic expectations sometimes, and you tell them what you can do and what you can't do, the actual treatment itself doesn't take that long.
Is it just for older people?
No, I'm seeing younger and younger people for neuromodulator treatment, because if you start early, then you don't make the wrinkles. Okay, you and I have permanent wrinkles on our foreheads. Okay, because we've been doing this our whole lives.
They're permanent?
Well, the skin folds are permanent. And so if you start with neuromodulators earlier in life, before those wrinkles form, they'll never form.
Well, how come I didn't know you years ago? I would have started to prevent this from happening.
Yeah,
or just don't look worried or shocked.
Well, that's the thing, I mean, that's the thing. A lot of people have that sort of that resting worry face. That you can help with those kinds of things.
Or laughter, right? When you get the crow's feet on the side of your eyes.
Sure.
Laughter or squinting and laughter will cause that.
Exactly.
But you can get ahead of the game. So this is why I hear that somebody, I don't want to go to teenage years. That's kind of ridiculous.
Yeah,
but somebody in
definitely.
their 20s would actually consider Botox. It's to be preventative, I guess, right?
Right. Yeah. I mean, I think certainly the age group that I'm seeing the most is 45 to 55, in that range. But they're younger women, and not so much men, but we see men too. But younger women we're seeing in their 30s for this kind of thing.
So you say it just takes about 10 minutes, other than the preamble, the markings and the getting to diagnose and assess the patient. Is it? I know you said you use little needles, 32 point, but is it painful?
It's a little pinprick that lasts just a second or two, because each one of those injections lasts about a second. So
let's. I guess I'm trying to figure this out now. Can you detect, if I looked at a person, could I tell if they've had Botox? Because I can look at a person and detect that. When you looked at Joan Rivers, when you looked at Kenny Rogers, both of whom are deceased, but you could look at them and go, oh, they've had a facelift. And there's a joke that, actually, it's not a joke. I think I told you this off the air last week where, and this is not a joke. This is actually a true story that Kenny Rogers told a late night talk show host one time. He goes, I know. I'm not going to have, he did one of these. He pulled his face back and he goes, I'm not going to do it anymore. I'm not going to have another facelift. And I forget who it was. Was it Jay Leno or something like that? This is a few years back. Said, well, why? You look great. You look great. I look great. And Kenny Rogers goes, because I came in second place at a Kenny Rogers lookalike contest. And he was dead serious. Yeah. People were laughing. He goes, no, hold on. That's a true story. Yeah. I did. And then he goes, once they realized it was me, I signed autographs and took pictures, he says, but when I didn't come in first, I knew I had way too many. Right. So
he was done.
So using that as an example where you can tell, and I'm not discouraging anybody from having a facelift or two, but when it gets to a point when you've had so many, it becomes, this isn't even realistic. You look like a doll that should be up on a shelf. Yeah. Can you tell when someone's had Botox like you can tell when someone's had a facelift?
If they've been overtreated, I'm pretty conservative with this stuff because the aesthetic has changed. Just a few years ago, the aesthetic was to basically, and it's still happening in Hollywood. I mean, if you see women and men on talk shows and so on and so forth, you see that their faces are just not moving. Yeah. In the general public, that aesthetic is really not what's happening. People want to have a mobile face. They don't want to, laugh and have nothing move on their face. They don't want to cry and have nothing move on their face or smile. So the aesthetic has changed over time. But by the same token, I do this. So for the most part, I can certainly tell when somebody's been overtreated. Definitely.
How?
Because their faces don't move.
Okay.
Yeah.
That's what I was thinking.
Their faces don't move. When they smile or they laugh or whatever, nothing moves. And I consider that overtreatment, although a lot of people like it that way.
All right, so this might be an awkward question, but be honest. Have you ever declined a patient, which would be taking money out of your pocket, Doc, because you just thought in your heart of hearts, just as a professional going, I can't, this person's either had way too many or this person, it's in their head, they really don't need Botox or any of it,
Oh, yeah. Last week.
Really? Oh, really? As soon as last week?
Wow. A woman came in looking because her friends all had Botox treatment. I said, look, man, you don't really need it. She had no lines on her forehead. When she smiled, she had very little in the way of wrinkles in what's called the lateral canthus, the side of the eye. And I said, go like this. And she really had no, that's called the glabellar complex, what people call the 11s. There was nothing going there because she was young and those muscles were fairly weak and she really had no lines forming there. So I said, wait 10 years, wait 5 years, see if you need it, But right now you don't need it.
How old was she?
Early 40s.
Maybe she was trying to be preventative like we were just discussing.
Yeah, but she had no movement at all. And it was just because the way she's built.
Let's talk a little bit about fillers. Mm-hmm. And not only asking you what exactly is a filler, but maybe in your answer you can differentiate between a filler and Botox.
Oh, yeah. Completely different thing altogether. You can do Botox treatment in, like I said, 15 minutes. Dermal fillers, what you're doing is what's called facial volumization. As we get older, we have fat pads that are very strategically placed around our face, for instance, in the cheeks, okay? You've definitely seen women have fillers in their lips. Okay, that's the thing you see every single day. And so what happens is we lose fat as we get older. As we get older, this angle of our jaw becomes less and less angular, and we lose it. It becomes more rounded and less sharp. And so what happens as a result of the loss of the fat in our face, the loss of angulation of our jaw, our chin gets smaller. This happens. Okay, all this stuff happens here. And so dermal fillers, first of all, what they are, it's hyaluronic acid. It's something your body makes already. It's a sugar, basically. Hyaluronic acid is basically, it's a hyaluronic acid gel that is made in different thicknesses for different areas of the face. And so let's say you came to me, and although you don't need it, quite frankly. But let's say you came to me 10 years from now, 10, 15 years from now. Your cheeks would be a little bit sallow. Your temples would be sunken like this, okay? Because we lose all this fat in our face. And so you want to rebuild infrastructure in the face by using dermal fillers. And so it's very strategically placed, not in the skin, not under the skin. For the most part, it's placed under what's called the SMAS layer of the face, which is what plastic surgeons use, that SMAS layer, to create a facelift, okay? So it's deep to that SMAS layer, and a lot of it sits right on the bone. And so you inject these fillers here to start with, because what you're doing is you're building infrastructure on the face to recreate that structure of the face that looks very young, okay? And that takes weeks, because what happens is when you put these dermal fillers in, they're very hydrophilic. They suck water up out of your tissues, and so they become more full over a period of 10 to 11 days. And so it's the kind of thing where you see it, you see a patient back in 10 or 11 days, you say, okay, let's assess the level of improvement we've seen. Let's augment that. You always start at the upper face and then work your way down. And a person who comes to you for volumization, the lips are always the last thing that you do, the area around the mouth. Now, that being said, there's lots of young girls who come in for lip filler. Now, those young girls do not need any facial volumization. They're just coming in for lips, and so you work on their lips with them. But it's done over time, because you build until you get the result that you want. And just like putting platelet-rich plasma in a knee that's osteoarthritic to lengthen the amount of time that it takes to go for a knee replacement, this is something that you can use to lengthen the amount of time that it takes for a person to need a facelift. And sometimes it's kind of, to a certain degree, it is kind of a liquid facelift, in the sense that you can prolong that period of time, let a person go all the way into like their late 50s or something, 60s, whatever, before they have to have a facelift. And then, rather than having one after the other, like you mentioned Joan Rivers, which she's the classic, right? You can lengthen that period of time up to the point where a patient undergoes a surgical facelift.
What's in this gel? What are the ingredients? You said
it's a single entity. It's hyaluronic acid. Oh. Hyaluronic acid is found in your joints. It's what greases your joints.
Okay.
It's found in the soft tissue of your body. Your body makes it. It's an isomolecular a substance that your body already makes.
Folks, you're listening to HyperFit Radio with Dr. Charles Guglin. We're talking about age management, really. That's what HyperFit MD is. It's an age management center down in Milford. We'll get to that in just a moment. Along with Dr. Charles Guglin, I'm Gary Byron. How long so we got 6 to 8 weeks from Botox, but now with filler, how long do these results last?
Oh, year to 18 months.
Oh, okay.
Yeah, it lasts a long time, yeah. And so what you wind up doing is once you create that infrastructure, and once you kind of finish the job with somebody, then they're coming back for touch-ups here and there over long periods of time. So yeah, for the most part, there's different thicknesses of this stuff to use in different parts of the face. In other words, in the upper face, you want something that is very thick and fairly immobile, because that part of your face doesn't move. But you need something that's thinner in the lips, because the parts of your face that move, it needs to move with those parts.
This has got to hurt, though, right? Come on, be honest, Doc.
It's not fun. It's not fun. The fillers do have local anesthetic in them, and so you work slowly, go from one side of the face to the other, because as you're putting a little bit in here, then it becomes numb. You work on that side, then it becomes numb. You go back to this side. So the dermal fillers themselves have local anesthetic in them. So as you're working along, it becomes more comfortable.
I would imagine not just for the sake of vanity, but I'm thinking people who have been in accidents, whether a vehicular accident or they had some catastrophic incident that occurred where they needed reconstructive surgery. Mm-hmm. Maybe they come back. I mean, is this...
It's helpful for scar revision.
And for scar revision,
yes,
okay.
And for like acne scars and stuff like that. It's helpful for that.
Are there risks with this?
Yes, there are risks. The facial anatomy is extremely complex, much more complex than pretty much anywhere else in the body. And it's not so much about if you don't know in particular the vascular anatomy of the face, you can put this stuff into a blood vessel. And I think I saw a statistic, 48 times in the United States in the last 4 years, someone has been blinded using dermal fillers, because virtually all the blood vessels around this part of the face, especially
by the eye.
By the eye. Sorry about that. And especially what's called the angular artery that goes up along the side of the nose. If you put it in any of those vessels, they all communicate with the retinal artery, and so you can cut off the blood supply to the eye and can cause blindness. The knowledge of the facial anatomy is critical to doing this safely. Plus, if you want to have good results, you have to have knowledge of the facial anatomy, because there's several layers there. Certain parts of this go deep, certain part like right on the bone. Certain parts of it go more superficial, and parts of the face where it needs to be mobile, like the lips that we talked about. The nasolabial folds, which are these folds that go from your mouth down to the corner, from your nose down to the corner of your mouth. That moves, and so the fill that you put in there needs to be mobile, needs to be be able to move with it.
Boy, oh boy. I'm imagining this where you have that done. Will it look natural, or
if it's done right? Again, you have to. I just happen to be looking at the TV here. That woman is filled to the max. When you look at her lips, my God, she's got like 12 pounds of fill in her lips. She just looks terrible. And the Hollywood aesthetic is a little bit different than the street aesthetic, if you will. Okay, the Kardashians are overfilled. All right. But it depends on
purposely, though, right?
I think, yeah.
To overemphasize,
whatever, yeah. I mean, yeah. To overemphasize whatever you choose, right? But I think most of the people that come into my practice are not into rejuvenating look more than anything else.
And this is all work that you do.
Yeah, we do it. We do it in our practice.
And there are benefits to this, right? I mean, there are benefits to this.
Absolutely. In business, the majority, I would say, not the majority, but a huge subset of the people that we see in our practice are business people who are in a boardroom, or they're on a Zoom call now, okay? We're looking at our faces all day long now, which we never did before. I'm a classic example. My whole life, I've looked at my face in the mirror once a day. That's when I'm brushing my teeth in the morning, okay? And now, because I'm doing Zoom calls with patients and so on and so forth, I'm looking at my face all the time. I think that's part of it. The whole boardroom thing, if you look a little bit younger and a little bit more awake and the bags are gone from your face and so on and so forth, you are much more engaging as a business person, too. It definitely plays a role in business, no question about it.
Listen, I mean, it's all about feeling good about yourself and having confidence for you to do your work. And just like people lose weight or get hair transplants or do anything to make themselves, to build up your self-esteem.
Yep.
And you're not hurting anybody else. How can you be against it? Going into your face, though, you said something that was pretty significant, how it's very complex and you've got very key muscles, particularly around your eyes. Mm-hmm. You're using a numbing agent, right, on each side of your cheek while you're doing this work?
Sure.
Like an anesthetic, I suppose?
It's like the same stuff they would put in a wound before they sew it up in the emergency room. It's lidocaine. Yeah.
How long does it stay numb for? Like, are you going home feeling like my cheeks feel like they're on fire or they're going to explode or they're just in great pain? Like, in other words, sometimes you can get a root canal and you've got Novocaine, the numbing agent, okay? And then the dentist does his work, and the Novocaine finally wears off, but you can tell.
No, this is not like that at all.
I had work, that Novocaine ran off. Take some Tylenol before it runs off, before it wears off, so that you can ease into it. But you're saying that this isn't as...
No. Sometimes, every once in a while, I hear that their face felt full. Okay,
full.
Full. There's certain parts where you put this stuff where it is confined into anatomic little rooms, let's say. and you're filling those rooms with fillers, so they feel a little bit full. But I've never heard somebody complain about pain afterwards.
Has there anybody that's come in for fillers and you say, no, you want Botox, or vice versa, come in for Botox and you've got to guide them as a doctor and let them know that, no, I think you're using these words interchangeably and they're two very different procedures?
Exactly. Yeah. I mean, a lot of what we do is educating people about stuff. I mean, a lot of times, for instance, people will come in and they're looking for your advice on how to deal with things. We always do the Botox first. We say, okay, go home, get a look at this, see what you think. If you're happy with the way this looks, come on back in a week. We'll do a touch up on the Botox if you need a touch up, and then we'll talk about the dermal fillers and we'll talk about it. See if you think it's a good idea, if it's a good fit for you, that kind of thing.
So, all right. So before we wrap things up, Botox maybe is a precursor to fillers. Start with Botox and then maybe,
Sure.
or sometimes you just say to somebody, let's go right to fillers.
Yeah. Not very often, though.
I would imagine. Yeah, you got to.
Actually, a lot of times they come in having been treated with neuromodulators in another practice, So they're done. They come in being fully Botoxed. So
if this sounds appealing to you, and you know what? I got to tell you, it sounds appealing to me. Not so much for the fillers, but I'd consider Botox. I don't know.
Why not?
Like in the forehead, maybe on the side of the eyes. Jeez, you got me interested in this. There's a couple of things that you can do to reach Dr. Charles Guglin. He's right here in the state of Connecticut, my friends, down in Milford. I would check out his website first. Go there first. HyperFitMD.com. Once again, HyperFitMD.com. When I said he's in Milford, he's down on Noble Avenue, 88 Noble Avenue, Suite 105 in Milford. But after you've checked out their website, maybe it'll spark a question or two. Jot them down. Give them a buzz. I mean this because, how else are you really going to know unless you sit down with him and he examines you and really gets to know what your desire, what your goal actually is. Area code 203-890-9777. Very easy phone number. Again, it's 203-890-9777. And if you want to shoot him an email, hey, listen, there's a couple of things that you can do here. You can email him directly at cguglinmd. That's CGUGLIN MD at HyperFitMDAMC.com. Is that right?
Yeah, that's right.
Okay.
It's a long one. Sorry about that.
That's okay. Or you know what? If you want to ask a very general question, maybe nothing that's too revealing, you can certainly email this radio show. Who knows? You can get it asked on these very airwaves. And that's hyperfitradioshow at gmail.com. For Dr. Charles Guglin, MD, I'm Gary Byron. Until next week, thanks for being with us. We'll talk to you then. Have a good one, everybody. So long.